Welcome to University Hospitals Sussex NHS Foundation Trust Policy Training. Today I will be taking you through the Resolution Policy Training. The Resolution Policy is designed to ensure staff members are given every possible opportunity to be heard with a fair, consistent and supportive approach. The Patient First Model. The patient, first and foremost, is at the top of the triangle to make it clear that everything we do should always contribute to improving outcomes and experiences for the people we care for in our hospitals. This is the true north objective of our organisation, the one constant towards which we must always set our direction of travel in order to achieve our vision. One of the 4 themes include Our People. Your role as a manager is important in creating an environment where staff are able to speak up with any concerns in order to address them where possible in an informal and timely manner before they escalate and patient experience and/or care is compromised. Purpose of the Resolution Policy. This policy provides a framework for University Hospitals Sussex staff, ensuring that any workplace concern affecting employment and dignity at work are managed in a supportive, consistent, fair and effective way. The policy aims to ensure that any concern is dealt with promptly and with the purpose of achieving a timely and informal resolution where appropriate. This policy applies to all University Hospitals Sussex staff, including medical and dental staff. The policy embeds a just culture approach to positive working relationships where staff seek to resolve concerns informally and are treated with dignity and respect. Bullying, harassment, discrimination and victimisation. Bullying, harassment, discrimination or victimisation in the workplace can take many different forms, occur in a range of circumstances and be directed at an individual or a group of individuals. It is not the intention of the alleged perpetrator, but the conduct itself and the impact on the recipient that determines whether the action constitutes bullying, harassment, discrimination and/or victimisation. Bullying is defined as offensive, intimidating, malicious or insulting behaviour and abuse or misuse of power through means that undermine, humiliate, denigrate or injure the recipient. Harassment is defined as unwanted conduct related to a protected characteristic which has the purpose or effect of violating an individual's dignity or creating an intimidating, hostile, degrading, humiliating or offensive environment for that individual. Some forms of harassment may be unlawful under the Equality Act 2010. For further definitions and information regarding bullying, harassment, discrimination and victimisation, reference should be made to the University Hospitals Sussex Equality, Diversity and Inclusion Policy. Protected characteristics under the Equality Act 2010 are age, disability, sex, gender reassignment, race, religion or belief, sexual orientation, marriage and civil partnership, and pregnancy and maternity. Impact of unresolved concerns. Loss of trained, experienced employees, low morale of employees, loss of respect for managers, increase in absenteeism, ill health, premature retirement, reduced productivity, poor patient care service, cost of potential litigation, a rise in employment tribunal claims, loss of public image and reputation damage, confidence of the individual to speak up. Many workplace problems can be resolved informally, for example through a quiet chat. An employee could raise a problem informally by telling their line manager. Informal resolution. All employees are encouraged to raise concerns as early as possible with their line manager and then work to seek an informal resolution. If a member of staff does not feel able to approach their line manager or where this is not appropriate, a more senior manager within the department should be approached. University Hospital Sussex considers resolution of the workplace issues of staff to be a key priority for line managers. It is the expectation that managers support staff to resolve issues informally and in a timely way. Resolution policy guidelines are available on University Hospital Sussex intranet, along with accompanying letters for all stages of the policy. At the informal stage of the policy, managers are required to acknowledge concerns raised by the employee by responding in writing using the appropriate template letter. The employee is invited to an informal resolution meeting to discuss concerns raised. The outcome of the meeting and discussion points should be communicated in writing to the staff member. In some cases, it may be necessary to undertake further fact-finding, and therefore a reconvened meeting will be arranged. Informal approaches to reach resolution. Listen to the staff member's concerns. Summarise the staff member's concerns to gain clarity and ensure understanding. Gain understanding from the staff member of the outcome they are wanting to achieve from the resolution. Check with the staff member to understand what actions they have already taken. Encourage the staff member to take direct action and responsibility themselves. Offer the staff member the opportunity for an informal facilitated meeting. Offer the staff member the opportunity for mediation. Discuss with the staff member any other needs, i.e. training. Formal resolution meeting. Progression to the formal stage of the policy may be necessary if informal resolution has been unsuccessful. The manager should provide written confirmation of receipt of the formal written concern to the staff member within 7 calendar days of receipt. The manager should arrange to hold a meeting with the staff member and their support within a further 14 calendar days of confirming receipt of the written concern. Staff members will have the right to representation. The outcome of the meeting and discussion points should be communicated in writing to the staff member within 7 calendar days of the resolution meeting. Investigation. In cases where formal investigation is necessary, the University Hospital Sussex investigation policy refers. In some cases, further investigation or fact-finding is required, and the outcome of the investigation and discussion points should be communicated in writing to the staff member within 4 weeks. The staff member will be invited to a reconvened meeting within 2 weeks of the investigation conclusion, and the outcome of this meeting communicated in writing with 7 calendar days of the outcome of the meeting. Appeal. The staff member has the right to appeal the outcome of the formal resolution meeting. Appeals must be lodged within 7 calendar days of receipt of the decision letter and will be dealt with in accordance with the University Hospital Sussex appeal process. For further advice and guidance, please contact the Employee Relations Advice Line in the East on 01273 696 955 extension 67611 or by email at uhsussex.employee.relations@nhs.net. For the Employee Relations Advice Line on the West, please contact 01903 205 111 extension 85722 or by email at uhsussex.hradvice@nhs.net. Thank you.